So dear students, today we'll talk about lactose intolerance. Lactose intolerance means there is inability of the patient to digest the lactose. So we know that lactose is a disaccharide and this is digested by enzyme that is lactase. So when we have lactase enzyme deficiency, this is called as a lactose intolerance. So these patients, specifically children, will be unable to digest the lactose. So what actually happens? There will be diarrhea and bloating symptom because the lactose is not properly digested in these patients. So we know that lactose is a disaccharide. So this disaccharide is converted or broken down into galactose and glucose, which are monosaccharide. So disaccharide is lactose is a disaccharide. This is broken down into galactose and glucose, and this is done by enzyme that is called as a lactase. That we know that the deficiency occur in lactose intolerance. So in patients with lactase enzyme deficiency, this lactose will be not digested. So we say that there is a intolerance to the lactose. So clinical feature of diarrhea, bloating, and so on will occur. So what actually happen if lactose is deficient? What actually happen if there is decreased lactose remain inside the blood bowl? So what actually happen? The lactose will not be digested. So if lactose is not digested, this lactose will be present inside the bowl. So what actually happen? This will result in osmotic effect. What actually it means that it will attract the water toward itself, and this will cause diarrhea. So that is watery diarrhea. So let me draw a diagram first. Let's say this is intestine. Let's say this is intestine and this is a blood vessel related closer to it, intestinal. So we see that if we have lactose intolerance, then this is, let's say, lactose. This lactose is not digested into monosaccharide, so it will remain as a lactose and this will attract water toward intestine and that will cause a watery diarrhea. So osmotic effect, this is called as osmotic effect. So because of this osmotic effect, it will cause a diarrhea that will be watery diarrhea. So watery diarrhea occur in this case. So this is called as osmotic effect of lactose. Then celiac disease, we discussed that there will be various atrophy, but in case of lactose intolerance, there is normal appearing villi. Villi shape will be normal. As we discussed in celiac disease that this villi will be atrophied, but in this case we see normal appearing villi except viral enteritis. If some trauma or viral enteritis occurs, so in this case shape of structure of the villi can be disturbed, but usually there is normal appearing villi in case of lactose intolerance. Now let's see. If lactose is non-digested in the small intestine, then this lactose is fermented by colonic bacteria, and this fermentation causes the production of hydrogen and the stool pH decrease. So colonic bacteria ferment lactose if it is not converted into galactose and glucose. So it is fermented and that causes the production of acid, hydrogen. So that is, and fermentation that causes the decrease in the level of a pH. So decreased pH occur in this case. Now let's see causes. If we go toward the causes, then we have lactase non-persistence. It means that lactase deficiency occur. It means you can say that lactase level decreases with aging. So the level of lactase enzyme that is present inside in small intestine in normal people, their level decreases with aging. As we grow, as we age, the level of lactase deficiency, level of lactase decrease. So lactase non-persistence means that it is not persistent only in all type of people in all type of ages. And this is the most common cause of lactase deficiency. Then we see congenital lactase deficiency, that is rare. So congenital lactase deficiency is not common. The most common is a lactose non-persistence. Second number is congenital lactase deficiency. And we have a third cause, that is secondary deficiencies. In this we have mucosal injury. If mucosa is injured, this may cause a deficiency of lactase and lactose intolerance, bacterial overgrowth, etc. So we have different types of secondary deficiency in this. More specifically, mucosal injury and bacterial overgrowth are common. So these are the causes of lactose intolerance. Now we see the symptom. What type of symptom will occur in lactose deficiency? So as we know that lactose is not digested, it causes osmotic effect, and because of this it causes diarrhea, and it also cause bloating and abdominal pain, which are related symptoms. And you should know that the symptoms occur when the patient with lactose intolerance ingests lactose containing product. That means include milk and dairy, that for example ice cream. So symptoms occur with lactose ingestion. When it means any time when patient ingests lactose containing food, then the symptom will occur. And these sources of lactose include milk and dairy, that ice cream. And the symptoms include bloating, abdominal pain, and diarrhea. So these are the signs and symptoms. These are the symptoms of lactose intolerance, and these symptoms occur more specifically when lactose ingestion occurs. Now let's see diagnosis. In diagnosis, we mainly do lactose breath hydrogen test. So in lactose breath hydrogen test, what we do, in this case, a patient ingests lactose. If this lactose is not digested, we know that lactose is now digested by lactase into galactose and glucose. But in case patient ingests lactose, we allow the patient to inject lactose. If this lactose that go into the small intestine is not digested, then it will remain in the small intestine, and in the small intestine bacteria will ferment this lactose, and hydrogen level will increase and the pH will be decreased. Now we measure the exhale hydrogen level. What we exhale, that level is measured. It is increased if there is lactose intolerance, because the hydrogen production is increased in case of indigestion of lactose, and that is more than 20 ppm compared with the normal baseline. So let's discuss patient. What actually do patient ingest lactose if undigested? If the lactose that is taken by the patient is undigested, then what actually happens? Then bacteria ferment this lactose inside the small intestine and hydrogen production occur. We might this exhale hydrogen level and increase lactose intolerance. If it means that if lactose intolerance occurs, then the level of hydrogen is increased, and that is more than 20 ppm compared with the normal baseline. So this is the lactose breathed hydrogen test. So let's come to the treatment. In treatment, we can do the treatment by avoiding lactose containing food. Those food that contain lactose should be avoided so that this and symptom does not occur. Then we can also give lactase, oral lactase enzyme supplementation, so that lactose is digested. We also give calcium and vitamin D supplementation and treat the underlying cause. So this is the lactose deficiency, in which we discuss different things. So